Hey guys and gals, it's Dr. Marcy, and I want to talk to you a bit about the basics of your annual blood work and how we can help you regain energy, lose weight, and feel more empowered in your health journey. Your blood work can give you these three things. Number one, how it can reveal indications and clues that you are that explain your low energy and your weight gain. Number two, the new way of looking at your labs that can reveal why that low energy, chronic pain, and stubborn weight won't budge. And number three, how your blood work can be linked to your depression and anxiety. And a lot of people are going to tell you that it's not possible to see this in the blood work, but it completely is. And in this little training, I'm going to show you exactly how and why. So this is for people who are motivated. They are tired of being tired all the time and they are ready to change. They have stubborn weight gain and they're frustrated by it. And it's usually that part around the middle or like the cottage cheese that's developing on their legs and they just want it to go away. They probably suffer from a chronic condition, whether that's fatigue, pain, an autoimmune disorder, blood pressure issues, diabetes, etc. And they feel frustrated by being told it's normal for your age, or it's normal now that you're a parent, or it's normal now that you're a mom. A lot of them are suffering with brain fog and they are ready to do the work to make sure that they get rid of these problems and they don't come back. So, who's this not for then? People who are all about freebies. I'm going to give you some great information here that you can start working on to make change. And if that's all you want, you'll get some information. So keep watching. But it takes time and an investment to get fully better. Those who are looking for a lose weight quick scheme or fad diet, I don't do those things. I really work with each individual on their specific blueprint. Those who are not ready to do the process and want to fight every step of the way. This is going to take work. It took me 6 years and over $100,000 to figure out exactly what was going on with my body and fix it. And I know that we can do it for less and in less time, but you've got to be willing to work with me. And lastly, this is not for people who are very attached to their diagnosis or the identity of not being well, or get some pleasure or benefit or dopamine hit out of being the person who never feels good, who always has a story about how sick they are or how much pain they're in, or how oh, I just can't today because this is not working well or that. And they never step outside of that role and push themselves. They're playing the role of the victim, not the person who wants to be empowered in their own life and make decisions that constantly move them forward. So if that last one offended you, there's going to be some other things that might make you feel worse. You might want to leave now, but again, you're welcome to stay. So in the old way, we would go to 5-minute doctor appointments where we weren't actually getting answers. We were just getting a new prescription for something. We were being told that medications were the only option. We feel stuck in those situations, even though we've done everything. We've done the perfect diet. We've done the perfect exercise. We've tried to get 9 hours of sleep. We're limiting our calories. We're doing all the things that people tell us to, and it's still not working. Being told that it's just your age, that you're in middle age, or you're a new mom, or you're this, or you're that. My favorite one, being told that you're too type A. Just relax. Let me be the doctor. I hate that one. Being told that your disease about managing symptoms, not actually curing it, because there is no cure. Well, I don't believe that the body was designed to attack itself. So what's causing that stress that's making it attack itself? And let's fix it. And then feeling like you're just not seen. Like you could walk into the doctor's office and have a paper bag over your head and it wouldn't matter because they never even look at you anyway. They're looking at the screen that's in front of you and never see you. So if that's the old way, what's the new way? Well, it's pretty simple. We spend one-on-one time together, and our appointments are all about looking at your specific blueprint. And we know that you feel heard and seen when you leave the appointment because we talked to you like you were a human being. And the solutions that we offered were things that we came up with and brainstormed together. Because, yes, I've got a lot of answers, but also I don't live in your body 24 hours a day, only you do. And so it has to be a team effort, and it may take me and other providers to get you there. And those providers might come from very different professions. The idea that knowing that having this genetic blueprint in front of you tells us that what we're doing is exactly perfect for you. The feeling of making constant progress every week and never hitting those plateaus anymore. Having more energy, feeling stronger, making progress in the gym, making progress at work, making progress in your relationships, and feeling empowered to actually push back when a doctor says, I'm sorry, we're just symptom managing. We don't have a cure for you. And knowing what to say in those situations, knowing the questions to answer and to ask. So how did it all begin? The epigenetic approach is truly based on genetics. It's a customized plan that allows us to have empowered decisions and normalizes full health. We really focus on vitality of each individual, because when we stop looking at the individual who's in front of us, we might as well walk out of the room and stop practicing anything in the medical field. We have to really focus on those detox pathways, because if we don't, the person will never be normal. They will have anxiety. They will have lack of energy. They will have poor sleep. They'll have poor libido. They'll have poor hormones, and they'll have chronic conditions. And we have to work on the mindset, because if we don't shift that, none of this changes. So the first thing we're going to talk about is how your basic blood work can reveal indications and clues that cause low energy and weight gain. Why is this so important? So you can better understand what the numbers actually mean and where you need to ask for better support and options, and when the blood work alone is no longer enough and further testing should be done. In the CBC with differential, the RBC count and numbers in that category can lend to a better understanding of inflammation, weight gain, chronic disease, and lower energy. But sometimes what we really need is to further understand why and what else is affected. And this can be found in the genetics. Genetics being supported can change the blood work over time and ultimately how you feel, how you look, and how you age. You could actually seem to age in reverse. And you could come off medications that you've been told were going to just increase over time and were now a part of your life forever. The crazier part, it can literally be done at any age. I've worked with clients from age 9 to 90 with success, stopping the process of disease in all of them. So what would it mean if you could sleep through the night in the next 6 weeks, regain your energy and your desire, feel like you're still making progress and not having plateaus? And then you could go back to the physician and say, let's run the numbers again, and watch in awe as they simply tell you, you're doing great, keep going. They don't even ask you what's different. They don't want to know who you're working with. They just assume it's something they've said along the way or the medications you're taking. So I'm going to tell you about Chuck. He's an 83-year-old man who came to me with type 2 diabetes. He had back pain. He was on insulin, metformin. He was on a statin drug for cholesterol. He was on blood pressure medication. They wanted to put him on a medication for emphysema and polyarthralgia. He was morbidly obese. I asked the doctor for 6 weeks. Just give me 6 weeks. In that 6 weeks, he lost 26 pounds. He had to come off his blood pressure medication. They cut his statin in half. He came off the insulin. He came off the metformin. And he no longer had a diagnosis of emphysema or polyarthralgia. At the end of a year, he had lost 50 pounds. And he came off the statin drug. 83 years old. He hiked for the first time in over a decade and is able to do all the yard work he wants with no back pain. Can you imagine at 83 being healthier than you were a decade previous? Number 2 is a new way of looking at your labs that can reveal why you have low energy, chronic pain, and stubborn weight. The adrenals and the kidneys are directly linked to one another, but the numbers are not always what we think is healthy, and no one really seems to know why, and they aren't paying attention to what makes them shift or how to improve them or make them worse or better. So sodium is one of those numbers. The ideal range is 135 to 140. You need it to make antidiuretic hormone, but it has been demonized by Western medicine. They measure it in the blood work and don't tell you what it could mean. Chronic pain and chronic fatigue can be answered by making this number more normal. Potassium is another electrolyte that is measured, but they tell you it's heart related. The thing they don't tell you is it also controls your energy, it controls pain, it controls water, and it needs to be in a specific range of 4.0 to 4.5 to make you feel well. Think of it like this. If your adrenals use these two things to help balance water and energy, what happens if they're out of balance? Where does your body focus? And how do you move when you need to pee every 10 minutes? From there, cortisol either at the beginning is overproduced and then at the end underproduced. It leads to spikes in insulin. It leads to spikes in blood sugar and blood pressure and heart rate. This leads to pain, swelling, and weight gain because your insulin resistance increases over time as well because you're constantly producing insulin because of the spikes in your blood sugar. So if we know that the numbers are not in the ideal spot, how do we change them? Just eat more or less salt and potassium, right? Wrong. The answer actually lies in stress reduction internally. You see, when something is going wrong with these numbers, there's usually something else wrong in the blood work. And let's face it, most of us aren't getting rid of the external stressors of work, marriage, kids, money, etc. So we have to find a way to fix the internal stressors inside our body and work on our breathing. I'm going to tell you about Noah. Noah was a 44-year-old guy who came to me with sleep issues, urinary and bowel frequency, and severe ankle swelling a few times a month. He also had bouts of back pain that he couldn't relate to really anything. They would be like little movements that he did would set off his back for 4 to 6 weeks at a time. Sugar cravings, afternoon fatigue, and joint pain throughout his body were also issues, and he had about 30 spare pounds that he wanted to lose. The problem was that he couldn't get his sodium and potassium in balance in his blood work because he had a low-grade chronic infection in his gut. He had long-term GI issues that we started working with. They were generalized discomfort, bloating after meals, never feeling full, never feeling satisfied with a meal. His bowels were not consistent, so he would sometimes have hard stools, sometimes have very loose stools, never quite diarrhea, but not normalized stools. So we worked on cleaning up his gut, supporting his liver because his genetics said he needed support there. And lo and behold, the adrenal stuff cleared up, and his sodium and potassium have now been in balance for 2 years. He also hasn't had an episode of low back pain in 8 months. So then, how does your blood work link directly to depression and anxiety? I know you don't want to feel icky or anxious or out of control, and you want to support your system instead of just medicating it and muting it all the time. So let's break it down to 3 keys. Number 1, the detox in the liver is genetic based. So is MTHFR, but the genetics that get missed most are GAD1 and GAD2. The numbers that we look at in the liver panel related to this are AST and ALT, and they should be as close to 15 as possible. The cholesterol should be 175 to 225. Triglycerides should be 88 to 113. LDL should also be 88 to 113, and your HDL should be greater than 55. Now, a number that does not get looked at very often and can be off in teenagers while they're growing, particularly males, is alk phos, which should be 44 to 90. Also, proteins don't belong in the blood in large doses. They are needed to build and repair tissues throughout your body. So your total protein should be somewhere between 6.9 and 7.4, the albumin 4 to 5, globulin 2.4 to 2.8, and the AG ratio 1.5 to 2. If it's off, that indicates problems going on in the gut and a leaky gut. If we have leaky gut, we don't appropriately produce dopamine or serotonin. If the liver enzymes are off, we don't appropriately produce acetylcholine. But the other things our genetics tell us is what medications could be helpful and which ones could harm us. Did you know that some of the side effects of antipsychotics is what they call tardive dyskinesia, psychosis, and suicidal tendencies? And they give you these medications without telling you whether or not you can handle them, and they make your anxiety worse, and they could cause you to do self-harm, and they just say, let's try another one, that one didn't work. We can take the guesswork out of it. Knowing these three keys, you have a choice. You can keep trying those medications that are only getting higher and higher doses and maybe making you feel worse, or you can support the pathways in you specifically that will optimize your health in this area. So Chantel is this kick-ass, amazing woman who does literally $1 million in sales a month in single-family homes. But for 10 days out of every month around her menstrual cycle, she could not leave the house due to crippling anxiety. She couldn't drive herself. She couldn't talk to people. She couldn't be in public. And she saw 3 different functional medicine providers, a psychiatrist, her primary care doc, and a couple other people before she found me. She already had genetic testing done, but everyone told her it didn't really mean anything. We started, based on her blood work, with a simple liver detox, and for the first time in 3 years, she didn't have an anxiety attack around her menstrual cycle. You know what else changed? Because it changes the hormones, and anxiety is directly linked to estrogen, by the way. She had a normal menstrual cycle, where she only had a menstrual cycle for 5 days. She only needed light, medium, feminine products for support. And she was able to go about her day as if nothing had changed, like she wasn't on her menstrual cycle. Her cycles for the 15 years prior to this had been 8 to 10 days of not being able to leave the house because she was hemorrhaging blood. She had intense pain, headaches, nausea, and vomiting. And no one thought that was a problem. They just told her it was normal. We changed this for her in a month. When we looked at her and continued to support her liver genetics, her MTHFR genetics, her GAD1 and GAD2, it's been 8 months since this woman has had a difficult period or a panic attack, and there's been almost no anxiety. She went to $1.5 million a month in sales of single-family homes that range in price between $250,000 and $350,000 just by gaining those 10 days back in her month. So here's your invitation. I've shared with you how your basic blood work means more than you previously thought, and how a little further testing can gain a lot more insight, and how to solve the most common health issues that we see in today's society. So now I'll leave it in your hands. You can go back to the way things were and hope that things will change. Or we can go deeper with this and you can get support solving this issue with you. If you're the latter, let's hop on a call and see if we can help. You'll see a calendar below. What I want you to do is find a time that works best for you, answer some questionnaires, upload your blood work, and I'll look forward to talking to you soon. Have a great day.